What do you?
I mean, here's the thing that always gets me about the conversation of who should or should not get coverage. It doesn't really matter because at the end of the day, if you need emergency room treatment, you're going to go to the ER, and they have a duty of care to treat you, and that costs way more money doing it that way than if it's done under the guise of some kind of insurance plan. It's like the old adage of, yes, illegal immigrants shouldn't have a driver's license and shouldn't be able to get car insurance, but if you get hit by a car by an illegal immigrant, like it's going to cost you way more money than having that protection. And so I've never understood the argument of, oh, we're going to take these people off health insurance and somehow costs will go down. Like, no, they won't. They're going to go up because those people are still going to have to get care at some point, and we're just going to end up paying that out of taxpayer dollars anyway, and it will cost us way more money because it's not a pre-negotiated rate. It's an emergency room rate, which we all know is way more expensive if you have to go to the ER unexpectedly than if you have normal health insurance and are able to go through a plan where even the cost of your prescription drugs are already pre-negotiated and accepted. So I've never looked at that particular piece of the pie as a cost savings. That's a great political talking point. Yes, everyone would fundamentally agree. Do you think it's right that illegal immigrants have health care? No, of course, no one thinks that they should. But the economic reality around that is, I think, very different, and people don't always realize that. And so it's kind of smoke and mirrors budgeting that Republicans often play with that particular talking point. Um, I think that Ashley's right. There's no viable way to talk about actually getting into some semblance of fiscal responsibility without dealing with entitlements openly and honestly. I'm of a generation that understands Social Security ain't going to be there for me by the time I get there. I am paying into a system I will never see a dollar of return on. Some might call that a Ponzi scheme. My former boss, Daryl Issa, certainly did. And so we need to account for that in some way. We are all still acting like it's 1980 and 1970 and that all these entitlements will be there the way that we've expected them to, the way that they'll be there for our parents. But they're not going to be there for people of my generation. So why are we even paying into it at this point? There's no point.
Kurt, can I tell you something very sad about the '80s you just brought up? Someone tweeted or X'd me, last week that said the '80s are calling and they want their hair back. They made I think I have nice
Oh,
hair.
Wow,
you have
you.
great hair.
Well,
That's just
no, I
mean.
don't. I don't
Come
even. I don't
on.
even get. I don't even get that. But
Meaning that my hair is
no,
from the
I'm
'80s and that
responding.
I'm
I
No,
wearing it
I don't think. I
disagree.
now.
don't think it is.
I didn't see
Obviously, it hit a
80s.
Well,
chord
it's
in me, Kurt
but
and Dave.
I The '80s were a time of big hair,
yeah,
MTV, rock bands. Like, that's
and
not
they
what
were
you
also
have.
in
That's
terms of the cultural
ridiculous.
contributions to the country, they were a pretty vapid. But I want to get back to what you said about healthcare because I think it's true. We don't use more in this country; we just pay more, and the main one of the main reasons is because our system is so privatized. We have about a 22% overhead. In France, I think it's 2.5%. And I think the reason that everyone should have healthcare is not because I'm a flaming liberal, but just because it's cheaper. I haven't seen the only healthcare systems I've seen that even come close to holding costs down to the rate of inflation. You have the 80% of the population that's healthy subsidizing the 20% of the population that is sick. And that is the model that works. That's why you have to have, i.e., individual mandate, which was created by the Heritage Foundation, and which Mitt Romney embraced, and so did conservatives until Obama picked it up. That's important. You have to have healthy people paying into the system. Otherwise, you have what economists call adverse selection, and you're only insuring six people, and the whole thing collapses. So, our healthcare system has a lot of problems, but picking poor people off is not going to solve it.
No, it's gonna exacerbate it. It's just more expensive. If you don't have quality care and you get sick, you're only gonna get sicker, which is only gonna ultimately cost us more money to treat you. So it's like, I agree. And it's not a liberal, progressive, or Democrat, Republican. It is actually in everyone's best interest that everybody have health care.
What do you guys think about this most favored nation proposal that the president has? Do you know about it?
What is that?
So it's like prescription drugs, really. So pharma hates it. They're like up in arms because it's really saying in some of our government programs, especially that he can control,
Okay.
that you pay what the amount of the foreign country's paying. So we can't get charged more in the US than they do in Germany, for example. And so, of course, that's a very populist issue, right? I mean, everyone would agree on its head that, but it's like farmers like,
Yeah, I mean, I get the idea that like, hey, a tablet of Advil should cost the same thing here as it does in any country in the world, and any country in the world should pay the same thing that we pay, I suppose. I could see why pharma hates that from a business model standpoint, um, but I think fundamentally it's like, yeah, I think there's some again, that's a
well, this
very
isn't Advil though. This is like insulin. Like this is everything.
sure. Sure, again, I kinda feel that way, like, I mean, not all economies are created equal, not all currencies are created equal, but in general, yeah, we're all human beings living on this planet. It should not cost us more. We should not be paying a higher premium just because 'cause we're
Yeah,
Americans, I
I
guess.
think the argument that, and I'm not saying I support this argument, but the argument that comes from the business side as well is easy for those other companies, other countries to charge less because they're not the ones that develop the drugs. They don't have all the research and all the, the R&D costs that we have. I think a very simple solution would be you simply have drug companies say it's going to cost us how many billions of dollars to develop this drug, the marketing costs, the R&D costs, and we think it's fair to make a certain amount of profit. So you get to charge a certain amount until you reach those goals. Then after that, you sell it at a generic price. And the cost plus plus that to me is very fair because big pharma, I go back and forth on big pharma because yes, they've done a lot of things that are not honorable, and you can criticize them in a lot of ways. But we're the only country that's developing these blockbuster drugs, and that's why all this Doge stuff, and I have to say that's one of the nice things about Elon leaving because it shows once again what an abysmal failure Doge was, even by his own standards. But cutting back all this medical research, this is really attacking the lifeblood of our innovation.